on.
This is my presentation, PAS, which is physician-assisted suicide and the impact on Alzheimer's patients. For some background context, I have this quote from Wesley J. Smith, who is an American philosopher and lawyer and writer. Alzheimer's disease patients are at particular risk. In a recent poll from Quebec, where lethal injection euthanasia is legal, a chilling 72% of caregivers favor permitting Alzheimer's patients to be euthanized even if the afflicted person never requested it. We need to have better patient autonomy and protect our elders. For some more background context, this graph shows the euthanasia cases by year from 2012 to 2017. This is from the British Broadcasting Channel. There's a steady increase and a particular large jump from 2007 to 2010 with 1,000 more patients than suspected. Patient needs are being neglected, as the quote on the previous slide said, and patient care is a heavy burden on caregivers, a mental and physical strain. For stimulus material, I chose the graph from the Alzheimer's Nonprofit Association showing the large estimated increase from 2020 to 2060. And with future advancements, maybe a possibility of a cure or treatment for Alzheimer's could be a thing. And the growing 85 plus range is the younger section, growing older in the later years. The perspectives I'm looking at are patients and the treatment, how the treatment affects them, their families, about how the treatment of their patients affect them, and the caregivers and how they go through this. My research question is how should PAS be managed and who should oversee the authority over it? And my thesis is PAS should be managed through a carefully regulated legal framework that prioritizes patient autonomy and terminal diagnosis.
Good morning, everyone. Pardon the interruption. Students, in just a couple minutes when the bell rings, you are going to be taking your STAR tests. So you will report to your STAR testing room. If you're not sure where that is, please check your email. You should have an email with that information. Students, please remember to do your best on this, as we do use this as a measure of our school and as a measure of your growth as a learner. So please do your best and good luck. Thank you all.
Do you feel good? Just keep going?
Yeah.
Great. Okay.
You go ahead. And my thesis is PAS should be managed through a carefully regulated legal framework that prioritizes patient autonomy and terminal diagnosis confirmation with a need to ensure ethical standards, prevent abuse, and maintain public trust. This is an image of a half of a brain that has Alzheimer's, which is on the right, and a brain that does not have Alzheimer's, which is on the left. And the AMA, the American Medical Association, acknowledges that patients have the right to decide what procedures they endure, supporting the ethical guidelines of patient care. And that also goes into this other section of information. A 2017 study published in JAMA, the Journal of American Medical Association, that well-regulated PAS programs show very low rates of abuse/coercion when robust safeguards are in place, and this is following Oregon's Death Dignity Act. The second piece of evidence is a quote from Wesley J. Smith again on one of his other articles. Where assisted suicide is legal in the U.S., it is still not allowed for people who lack decision-making capabilities. This restriction may be a matter of political tactics rather than federal principle. The graphic explaining the reports of requested euthanasia in the last decade with different illnesses, which is dementia, which is the lighter color, other psychiatric disorders, which is the darker color, and this medium color is mood disorders. More patient reports require more caregivers and more strain on them, and we need a solid principle rather than a principle of political. My last piece of evidence, I have this quote from PMC. Legal frameworks like WDDA, Washington's Death Dignity Act, empower terminally ill patients to make autonomous decisions regarding end-of-life care. The act requires patients to be mentally competent adults with a confirmed 6 or less months to live. This other quote from CR in the Netherlands, RARC, a euthanasia council, composed of a physician, an ethicist, and a legal expert, assesses whether cases of euthanasia or PAS comply with the care criteria. They have a very deep care criteria, and they go over it once every year. So my solution is to enforce a strict eligibility criteria, provide oversight by a multidisciplinary ethics committee, ongoing education, public awareness, and finally, legal protection over patients. The limitations and implications include inequitable access to certain programs for these Alzheimer's patients. There's an administrative burden, a risk of coercion/pressure on patients, and moral and cultural differences because not everybody may agree with the same thing. implications include would allow patients the right to their own autonomy, which is a very important thing that everyone should have. And there will be an evolution on hospice, which is end-of-life care, and inspire social and ethical debate overall for research. Overall, we need to protect our elders and their care as well as provide for them, as they provided for us. Their care will be our care. Thank you, America.
Okay, Ellie, really quickly, what evidence did you gather that you did not use?
I found a few sources from more in the Netherlands, but I wanted to be more focused on the U.S., so I just started with them.
Okay. And what advice would you give other researchers who consider this topic?
Definitely double check your sources. There's a lot of misinformation over there in this section, especially because everyone is just taking the first thing they see and going off of that. So definitely double check your sources.
Great.